All right, welcome back, everyone. So this is going to be part 5 in our articulations lecture. And so in this part, we're going to begin looking at specific examples of articulation. So we'll look at specific examples of different joints. We'll look at their functional classes, their structural classes, as well as any other relevant and important features that they may have. All right. So we'll look at a variety of different joints throughout the body. Some will be part of the skull, some will be part of the lower limb, some will be part of the upper limb. All right. So as we go through these, again, pay attention to this specific joint in question, so the specific joint that we're looking at, but also pay attention and kind of hone in on what its functional class is. So in other words, how much movement is permitted at the joint, as well as its structural class. So is it fibrous? Is it cartilaginous? Is it synovial? All right. So with that, we will begin. So our first joint is going to be what's known as the TMJ, also known as the temporomandibular joint, right? And so all of these joint names, all of these articulations, their name usually corresponds to the two bones that make up the joint, right? So a joint or an articulation is usually just two bones joining together. So the name is usually a part or the name of those two bones. So in this case, temporomandibular refers to the temporal bone of the skull, and then the mandible. So mandibular refers to mandible. So this is the joint between the mandible and the temporal bone. All right. So specifically, this is the mandibular condyle, also known as the condylar process of the mandible. So if you see these two images down here, this kind of rounded end of the bone of the mandible here, as well as this one that you see right here, that is the mandibular condyle or the condylar process of the mandible. And then you have the temporal bone. So here's our temporal bone on this lower image, and then here's the temporal bone up here. And there's a small groove or a small depression called the mandibular fossa that's part of the temporal bone. All right, so the mandibular fossa is not part of the mandible, but it's in fact part of the temporal bone. And this allows the mandibular condyle to sit snugly in that depression, in that little fossa, and allows it to hinge. All right. So this joint, this TMJ, is a hinge joint, but it's also somewhat of a gliding joint. All right. So if you look at the animation in the bottom left of the screen, you notice that when the jaw opens, as it just did there, it is hinging. Right. So just like a normal hinge joint, like the elbow, you open and you close. Right. So you open there and you close there, but you also have slight anterior movement as well. Right. So you see this mandibular condyle, it doesn't just go straight down, but it goes down and forward. So it comes here and it comes down and slightly anterior. So this is the gliding aspect of the joint, right? So you have muscles called muscles of mastication. So your masseter muscle on the side of your jaw, your temporalis, and then these small muscles that you see way in here called your pterygoid muscles. All of these are involved with moving the mandible for the process of mastication, which is the process of chewing. Okay. So we know that we can move the jaw in this manner. So when the jaw opens as it did there, that is a depression of the mandible, and then when it closes as it does right there, that is a elevation of the mandible. Okay, so you have depression, you have elevation. You also have protraction and retraction, so moving the mandible anteriorly and posteriorly, and then you also have excursions, right? And so excursions are a side-to-side movement of the mandible. Okay. All right. You know that this joint is very mobile, so it's diarthrotic. And so if you recall from our discussion of functional and structural classes, we said that diarthrotic joints, they're typically synovial joints, right? And so this is an example of a synovial joint, right? So if we move to the next one, we have our intervertebral joints, right? And so for our intervertebral joints, we really have two types of two different intervertebral joints, right? So we have the intervertebral joint between the first two vertebrae, so the first two cervicals, so between C1 and C2, and then you have the intervertebral joints between the remainder of the vertebrae, all right? And those two, they're different, all right? So we're going to talk here specifically just about the intervertebral joints other than the one between C1 and C2. We'll talk about the one between C1 and C2 in just a little while, all right? So after this one. So these joints are considered a symphysis joint, right? So if you recall, a symphysis joint is a subtype of cartilaginous joint, and it was symphysis because specifically it is joined by fibrocartilage, right? So we have fibrocartilage as that's making up these intervertebral discs in between two adjacent vertebrae. You know that fibrocartilage is useful for withstanding shock and compression and large forces, and that's exactly what our vertebrae does, right? We know that these joints have some degree of movement, so they're considered gliding joints. Some movement, but not really enough that we can notice for one individual joint. So we can notice our whole back moving, but we don't notice two individual bones moving past each other here. So these are going to be considered amphiarthrotic, right? So they allow for slight movement at a particular joint, right? So if you take this view that we see here, and we essentially cut it in half, right? So this anterior, or this more kind of lateral part that we see anterior here, we're gonna cut that away, and when you do that, you get something that looks like this, all right? And so you have a number of different ligaments and connective tissue structures that span the width of our vertebral column, and these connective tissue structures serve to stabilize and keep in place our vertebrae, all right, along with various muscles as well, okay? So a couple important ones, you have these two here called the anterior. So you see this one here, anterior, and this one here called posterior, and these are longitudinal ligaments, right? So you have an anterior longitudinal and a posterior longitudinal ligament. These are longitudinal because they run the length, they run longitudinally, they run parallel to the length of the vertebral column, right? So these are the vertebral bodies, very large. So this is posterior back here. I'm sorry, this is anterior over here, and this is posterior with our spinous processes. And so these are running on either side of those vertebral bodies, and they serve to keep them somewhat in place and stabilize them, all right? So if you've ever been on a roller coaster, or if you have been in a rear-end collision in which you were in the car that was hit from behind, you know that your head can move backwards very quickly, right? And if this happens to an extent in which it causes damage and pain, you could refer to this as whiplash, right? And so whiplash is when you have a rapid extension of the neck, right? So the neck is flexing, or I'm sorry, it is extending posteriorly, and you're looking up toward the sky. And what you're doing is you're stretching this anterior longitudinal ligament, and that is typically what results in the symptoms that you associate with whiplash, okay? Now, you also have other ligaments. You have this one called a supraspinous ligament, interspinous in between the spinous processes, and one called the ligamentum flavum that adjoins these lamina, which are a part of the vertebral arches here. But all these are doing is just serving to keep in place these intervertebral joints and serve to stabilize them as well, all right? So if we now look at the other intervertebral joint, okay, so not these that we've been talking about, but the one between the first two cervical vertebrae. So we know that C1 and C2, this is referred to as atlas and axis. And so this joint is known as the Atlanto axial joint, right? So this term Atlanto refers to atlas, and this term here, axial, refers to the axis, all right? So this is between C1 and C2, and this allows for a pivoting motion. This allows for a nice pivoting motion of C1 around C2, all right? So C2 has a bony projection that projects superiorly, known as the dens or the odontoid process, right? And so this structure right here that you see, this little projection, this is the odontoid process, also known as the dens. Think of the term odontoid and try to come up with what this term means, all right? So try to think about if you've ever been to a healthcare provider that has something to do with this odontoid, right? So you may have been to an orthodontist, right? So an orthodontist has to do with teeth, right? So the early anatomists that named this thought that this projection of bone somewhat resembled a tooth. So they called it the odontoid process, right? So the odontoid process articulates with this arch here of C1, and then this ligament of C1 as well. And this C1 can then pivot left to right, side to side, around that dens, all right? And so what this allows for is this allows for our head to move side to side, left to right, and back again to non-verbally indicate no, right? So if you shake your head side to side to indicate no, you are using your Atlanto axial joint, right? This is a very mobile joint. It is diarthrotic, and it is the most mobile of all the intervertebral joints, right? So you can obviously move your head side to side more than you can move the individual joints or individual articulations between the remainder of your vertebrae, all right? Okay, so we're gonna stop here with part 5, and then we'll pick up with part 6 by getting into talking about the shoulder, and then we will ultimately move into some lower limb joints as well.